This is Dr. Barry Lykow, host of Inside Cosmetic Surgery Today on webtalkradio.net, your inside source of information on cosmetic surgery, information you can find nowhere else. Now, we're going to talk a little bit about breast implants. This is really getting to be a confusing area because breast implants have been used for a long time, and then just in the last couple of years, there's been some questions about their safety, etc. So a lot of good doctors have been forced to stop using some of the implants. Other doctors have been using these under investigational status. And now we even have new implants coming in. And just recently, there was a whole bit of controversy over in Europe and London and in France about breast implants that were causing a lot of problems for people over there. So today we have one of the world's authorities on breast implants, Dr. Adam Schaffner, who's a fellowship-trained plastic surgeon from the New York area. He works in Manhattan. He's going to help to clarify this for you. So how are you doing tonight, Dr. Schaffner?
I'm doing great. How are you?
I am simply fantastic, thank you. Now let's talk a little bit about breast implants and what's happened in this whole field in the last couple of years.
Well, breast implants are still very popular amongst women of a variety of age groups, from those who are as young as 18 all the way into people in their 60s and 70s.
In fact, most people say this is the most commonly done cosmetic surgery practice, or is close to the top. It all depends on who you talk to.
That is correct. So annual surveys are distributed to plastic surgeons nationwide, and over many years, breast augmentation has been either the number one or one of the top three most popular cosmetic or aesthetic plastic surgery procedures, and it is continuing to be very popular.
Now, the problem I understand, Adam, has been with the silicone implants overall. Those were the ones that were brought up as being possibly a problematic implant.
That is correct. So there was concern in the 1990s that this may be linked to a variety of disorders or disease processes. That was later proven to be incorrect or untrue. They were reintroduced into the market in the United States and then approved for use by the U.S. Food and Drug Administration in reconstructive patients and then subsequently for aesthetic patients.
That's right. So, and so a lot of doctors who were using the implants, the silicone implants, started using the water-filled implants, and some others stopped using them for a while, and then these implants have been brought back, have they not?
They absolutely have. So the key thing that people should understand is that both silicone gel and saline implants have a silicone shell, and it's the difference of what is in that shell. For saline implants, it's saline or sterile salt water, and for silicone implants, it's a gel. And it is now gotten a little more complex because of the fact that there are different types of gels. And there have been numerous generations of gel implants, but rarely have we had a time where we have different types of gels available at the same time.
And let's just go over for our listeners who might have heard about the big problems over in London and over in France with the implant that was there. What was the main problem over there?
That was called a PIP implant, and the main problem is the fact that the company that manufactured the implant did not use medical-grade silicone. They used industrial silicone, and so there were significant problems associated with that and higher rates of complications, estimated to be fivefold that of what would normally occur for medical-grade silicone gel breast implants. So they were subsequently banned, and then a lot of women are subsequently having them removed and replaced with implants that are made from medical-grade silicone.
Okay. So that was the problem over there. But to the best of your knowledge, that's not been the problem here. Is that not right, Adam?
That is correct. That is absolutely correct. It was never approved. That type of implant, the PIP implant, was never approved for implantation in the United States by the FDA. However, it is a problem because there are women who either went abroad or lived abroad had them in a country where it was approved, and then subsequently moved to the United States. So I personally have taken out a number of these implants and replaced them with silicone gel implants made from medical-grade silicone.
So what happens with these non-silicone medical-grade implants, these silicone non-medical-grade implants get into the skin? What happens with it?
Well, most of the time, the capsule, which naturally forms around any implant, walls off that silicone gel. And so if there's been no rupture of the shell, it's not a problem because you just take out the implant. If the shell is ruptured, then you have to take out not only the implant, but the shell and the capsule that's formed around that.
And the reason for that is because it acts like a foreign body in the skin, and when it does, the body starts to react to it and starts causing infections, it starts causing pus, it starts causing other problems that way.
That's exactly right. Another inflammatory processes and potentially autoimmune issues, and so it gets into a whole host of problems.
That's right, and that's the problem with that. But even silicone implants of medical grade, if the implants are left in too long, let's say they're left in 10 or 20 years, some of those will rupture too, will they not?
They can. So there's always a risk of rupture of an implant. Average risk is about 1% per year per implant. But as long as the implant is not traumatized, the implant should, in most cases, remain intact. One question I frequently get is, if I get a implant inserted into my breast, doctor, does that mean I'm going to have it replaced at some point? The answer is no, it's not a guarantee, but it is something that one should anticipate and plan for in the event that it is necessary.
Yeah, and I think this is a wise thing for people. Nothing is made to last forever, and I think people have to be realistic about these things as well, because if they're not realistic and they think it's going to last forever, I think that's the wrong expectation as well.
I completely agree. It's all about appropriate expectations. It's about appropriate planning and doing their homework and making sure that they understand what type of implant they're going to get, what the size will be, and what the risks are with the implant that they've selected.
Yeah. So, this is what it boils down to, is good communication with your doctor, understanding what risks are, understanding what the benefits are, because why aren't these the most popular cosmetic procedure on the planet overall, Adam?
I think one of the reasons is because of the fact that the female breast is associated with sensuality, sexuality. For many women, it is an issue of self-esteem and self-confidence. If their breasts are not large enough to meet their expectations to fill out a dress or a blouse or a bathing suit. And so by increasing or enhancing the size of their breasts, it gives them a sense of self-confidence that they might not otherwise have. And I think that's probably one of the biggest reasons is they want to feel feminine.
Exactly, and I think that's important. So I'm just going to talk to our audience for a minute. This is Dr. Barry Leica, host of Inside Cosmetic Surgery Today on webtalkradio.net. Today we have a special guest by the name of Dr. Adam Schaffner, who's a fellowship-trained plastic surgeon from Manhattan. He's informing us a little bit about breast implants, and we've just talked about some of the risks of breast implants. But he's also got some very exciting news for people in the United States, and it's about a new breast implant called the Natural 410 Highly Cohesive Anatomically Shaped Silicone-Filled Breast Implant. Now, this is new to the people of the United States because it's just been improved. But, it has been in Canada, where I live, for a long period of time. And this implant certainly has some big advantages over some of the other implants in special situations. What are those? Where would you find an implant like this being used, Dr. Schaffner?
An implant like this is very beneficial for a woman who desires an augmentation but doesn't want to have a lot of the upper pole fullness that is associated with the round implant. So a more mature breast, this would be fantastic for an augmentation. It's also superb for people who have had breast cancer and then underwent a mastectomy and then need reconstruction. This is a great implant for reconstructing the breast with a very natural appearance. It's also very beneficial in those situations where people who have had radiation therapy. And the reason being is that this implant is a little firmer than the smooth, round silicone gel implants, and so it resists some of the changes that can occur after radiation therapy.
So this implant sounds like it might be ideal for some people, but where would it not be ideal?
If a woman wants a softer implant, if she wants to have a lot of upper pole fullness, to have that roundness at the top of the breast, this is probably not the best implant for that individual.
And it's probably not the best implant for a younger individual, probably in the 18 to 25 range group.
Exactly, or even in their 30s. This is an implant that's really designed more for people who are older. A lot of them have already had their children, and so that's really more appropriate for a young woman in 18 to 22. Just for listeners in the United States, it is something where you would consider a salient implant because silicone gel implants for cosmetic purposes, a woman has to be 22 years of age or older for insertion in the U.S. So that's something to consider. But yes, in their 20s and 30s, I'd recommend a round silicone gel. If they're older, then you sort of start having some choices, and it depends on what the person wants.
Now, there are some limitations with this one as well. You said when we were talking earlier, Adam, about this has to be inserted through a bit of a longer scar, I think that could be something our listeners might be interested in as well.
That's absolutely correct. So because of the fact that it is a firmer implant, it is an implant that requires a longer incision to insert into the breast pocket.
It's just because a breast implant like this can't be pushed in or molded that easily to get into a smaller incision.
That's exactly right. So, and if a woman's had a mastectomy, normally the incisions are longer than that would be required anyway, so you don't need a separate incision or something that's going to be longer. But for the people who are doing this for cosmetic purposes, it will be a little longer scar than you would have if you were just having a silicone gel round smooth implant placed.
Mm-hmm. That sounds logical. Now, let's talk a little bit about the future of breast implant surgery. I've always found the best way to predict the future is to look a little bit into the past and see what's being done, and also seeing what's being done around the world, because, a lot of people are using different breast implants around the world and things like that. So let's let you look into your crystal ball for a minute there, Adam, and say, where are we going with all this stuff?
Well, I think that one important aspect to consider is the fact that a lot of people are now augmenting the breast with fat, and they're doing it with fat and implants. It's not mutually exclusive. And the benefit of using fat along with the implants is that you're able to help provide more soft tissue coverage over the implant so that the end result looks, feels, and behaves much more like a natural breast. And I think that is where we're really seeing the future, is with the use of fat for many indications, both in the breast and elsewhere.
Yeah, I think fat is now becoming of age because we've now found ways to make fat take a little bit better. When we first started using it, the rate of a fat when it was transplanted from one area to the other of taking was pretty bad, And now I think we've come to the point that we realize there are ways to make that much better.
That's exactly right. It also depends on how the fat is handled. It has to be processed a certain way, and then when you're inserting it or injecting it, you need to do so in a very careful way, small little tiny amounts, so that each of those areas get its own blood supply, and that you don't get a lot of what's called fat necrosis, which is where the fat doesn't attach to the blood supply and then therefore goes away.
Yeah, exactly. So that's one big thing that's coming out. I'm hazarding to guess that we'll have maybe 50 different implants over the next 20 years that a doctor has to really be cognizant about and choose the right one for the right situation.
Well, getting breast augmentation results that are aesthetically pleasing and long-lasting, I think first start with good communication, as you suggested, between the patient and the doctor, and then very meticulous planning. And that is something that I can't emphasize enough. And when you plan and measure properly with biodimensional planning, you're able to select the appropriate implant. And by doing that, you wind up having a long-term result with which the patient can be most satisfied.
Yeah, I think, we are getting better in that. We're also getting better with our 3D imaging, so we can see things in a way that we weren't able to see before, and I think that helps a bit. But I think it's the mind of the doctors that are being changed a lot and how to plan these things as well.
Absolutely. So 3D imaging is a great way in which to communicate with the patient, showing some asymmetries which may be pre-existing, both in the breast as well as the chest wall, and also to be able to potentially show a patient, based on a given implant size, shape, and style, what the breast may look like after surgery. And most of the time, when selected properly, the breasts after surgery look pretty close to the way in which the simulated pictures look from the 3D imaging that we're discussing.
Yeah, and that's huge. I've always found that the most important skill a doctor can have, in addition to being a great surgeon, is to be a great communicator. And I think those are the aspects that I look into my crystal ball and seeing as things coming and even getting better for the patient.
I completely agree. The other thing that I think that is really a game changer and almost a paradigm shift is the emphasis on precise pocket dissection. That means making sure that we're not just going ahead and putting the implants in lickety-split fashion, but really making sure that doctors are taking their time to properly develop the pocket into which the implant will be placed, and taking a variety of measures into account that can minimize risk of infection or capsular contracture, such as the use of the Keller funnel, which is basically a device which is, when wet, allows the implant to slide right in, not need to touch the doctor's gloves, and not need to touch the patient's skin.
Yeah.
So
I think these are important things, and I think the patient should be aware of this. If they're to learn one thing from this, and this is perhaps getting a little bit too highbrow for them, it's that a good doctor is constantly learning new techniques. He's constantly learning the problems and trying to overcome the problems. He's constantly developing things. He's constantly learning things. I'm going to ask you a question now, Adam, that's going to be a leading one. Is the way you do breast implants now, is it the same way you did 10 years ago?
No. So I think that anyone who's still doing surgery today like they did 10 years ago is probably not doing things the way it would be optimally done.
Absolutely.
Absolutely.
And I think that's the thing about this is a good doctor doesn't stay by yesterday's standards. He's constantly learning tomorrow's standards and looking for the better thing. He's looking for this new implant that came in just recently for the American people. He's looking for a new instrument to try and put the breast implant in there so that there will be less trauma for the patient and less so it'll be more predictable.
Absolutely.
Excellent. So are there any final words you'd like to tell everybody about breast implants and about the new and wonderful world of them?
What I would tell people is that breast implants are something that people know are popular. Some people are still afraid of them. Some people are still leery of silicone. Certainly, one can have all of the intellectual knowledge, but then there's the emotional component. And I think that educating themselves, talking to people who have had the procedure, looking at photographs and developing a rapport with a doctor who is properly trained in this area, I think are all key things for your listeners to take home. And if a person is interested, they should contact their board-certified plastic surgeons in their area that specialize in breast augmentation to learn more.
Okay. Adam, you've been a fount of information tonight, and I'm sure that there's many listeners that are downloading this teleconference, this radio show, really want to get in touch with you. So how can they do that? What's the best way for them to do so?
people can reach me either by going to my website at www.drschaffner, that's DRSCHAFFNER.com. They can also go to parkavenuebreastaugmentation.com and fill out the contact us, or they can call us at area code 212-688-6600.
Wonderful, Adam. Thank you so much. And again, I apologize for the technical difficulties we had tonight. I think it gave you and I a couple more gray hairs.
Not at all. It's my pleasure, and thank you very much for having me on your show.
Thank you so much. Dr. Barry Leica here. I'm host of Inside Cosmetic Surgery today on webtalkradio.net. I always have a lot of fun with our guests, and Adam was a great guest tonight. If you have any questions you'd like to ask me, the best way to reach me is through my email. That's baslcjsm@gmail.com, baslcjsm@gmail.com. Love to talk to you if you have any problems or any questions. Thanks. Have a great day.